This is a healthcare facility in Ethiopia. Ethiopia has the least developed healthcare system in sub-Saharan Africa and is among the worst in the world.
HIV/AIDS is a major issue in Ethiopia. However, malaria is the primary health problem in the country. It is the main cause of death and illness in Ethiopia.
The primary reason for Ethiopia's poor healthcare system is due to lack of physical access to even basic healthcare facilities in rural areas.
Ethiopia also faces shortages of clean water and poor sanitation. In fact, only 17% of people have access to clean water.
80% of the health problems in the country are due to preventable, communicable, and nutritional diseases. These health problems are associated with low socioeconomic development. We interviewed teachers and students of Daniel Hand and healthcare providers of what their take is on this issue.
As a citizen of the United States, do you believe that people take health care for granted in this country?
I think people do. I mean, the United States, yes, there are a lot of disprivileged people, but there are a lot of people that just can go to the doctor and get whatever they need checked out. In a lot of other countries around the world, people who are sick basically have to live with it, and a lot of people end up dying from diseases that they never even understand or have a chance to fight. So yes, I do think people take healthcare for granted in the United States.
I think the people who have it definitely take it for granted. Until you realize the benefits that it provides, I don't think you understand that the extent of healthcare. Like my own personal experience with it, especially in the last year, being sick and you know, seeing what types of treatments I needed, you know, between the chemotherapies and the surgeries and things like that. You know, that my treatments alone would bankrupt a normal human being.
As a citizen of the United States, do you believe that people take health care for granted in this country?
Because treatment over there is
yes.
terrible.
Actually, I do.
Do you believe that people take health care for granted in this country?
I do. I think that it becomes something you get used to. It's like people take running water and heat and air conditioning for granted too, and good food. That's something else we have in this country. I think that having lived around the world in other places and seen healthcare delivery in other countries, I think that we have a superior system in the United States in terms of the availability of technology, the quality of the doctors and nurses that deliver the care, as well as the therapies available in the top-notch facilities we have throughout this great country. I think we're very, very fortunate.
Do you believe that people take health care for granted in this country?
I sure do. I do believe it. I believe that they only learn about healthcare when they have a crisis.
How long do you think the life expectancy is in Ethiopia?
I'm guessing it's probably like 47.
Ooh, that's a tough one. I'm gonna say 17, the life expectancy.
I'd guess 35.
I think it's around 72. Like 20?
About 54 years and like 3 months.
I would expect probably in the 40s or 50s, and I would think that with the big HIV epidemic, it probably took out a lot of people that were younger than that. But now that there are drug therapies for HIV, I would say 40s, 50s.
How long do you think the life expectancy is in Ethiopia?
You know, I don't know for sure, but it sure doesn't sound like it's very old. I think a lot of children die very young just from malnutrition itself and all the diseases that they can catch that we are so lucky to have vaccines for.
What do you think is the primary reason for poor health care in general?
I think that the primary reason is poverty, because if you're poor and aren't wealthy and don't have enough money, then healthcare could be an issue because you can't pay your finances for the healthcare that most people would receive.
Well, I think that around the world there are a lot of doctors, but a lot of people are not trained, like doctors in the United States or in Canada or different parts of the world are trained at higher levels than doctors in other parts of the world. And because healthcare at times is so expensive for medicine and surgeries and things like that, that disadvantaged countries, people aren't able to afford it. therefore are not able to get what they need. And I think to really improve that, you have to get better doctors worldwide, not just in places like the United States.
Probably lack of funding.
What do you think is the primary reason for poor health care in general?
I think around the world, there are two different reasons. I think people's ability to access it is one of the primary reasons, and I think in a lot of the under or undeveloped world, it's a financial constraints that they can't provide the resources to provide quality health care. I think that's true for a lot of the world. Parts of the Western and developed world, such as the United States, I think access. The health care is here. Occasionally people don't necessarily have the means or the wherewithal to access it.
I think costs particularly here in the United States alone, the costs, people set their own prices and it's not regulated.
I need a doctor, call me a doctor. I need a doctor to bring me back to life.
These are just a few examples of citizens in the United States that are fortunate enough to have health care provided for them at all times, unlike those in Ethiopia who don't at all.
Many organizations such as Merlin, Harvard School of Public Health's Department of Global Health and Population, and Yale's Global Health Leadership Institute have worked to improve the healthcare situation in Ethiopia and have made some impact. Merlin has been working in Ethiopia since 2003, improving healthcare for vulnerable people in some of the most underserved areas of the country. Currently, more than 100 Merlin health and support staff work in coordination with the Ethiopian Ministry of Health in 9 districts of 2 regions, all of which are heavily affected by poverty, drought, and internal conflict.
Call me a doctor. I need a doctor to bring me back to life.